Welcome back to FAMWISE and welcome back to the module Happy Hormones. In this lesson, we're going to be talking about coming off birth control and different things that you can expect. There are many different types of contraceptives. So we have our hormonal types, we have the different procedures we can do, and then we have the barrier methods. So hormonal contraceptives disrupt the normal process in the body that help with ovulation, implantation, and sperm movement. Sterilization is where we are physically blocking the release of an egg or sperm through a procedure, and the barrier methods are where we physically block sperm's access to the egg. So you can see in this chart the different efficacies of these different types of contraceptives. So perfect use refers to how effective a birth control method is when used exactly as instructed every single time without any errors or lapses. This reflects the method's potential efficacy in a controlled setting with ideal adherence. Typical use reflects the effectiveness in real-world scenarios, accounting for inconsistent use, human error, or factors outside the user's control. So this measure is more representative of how most people would use the method. So the column on the right is the discontinuation rate within a 12-month period. But you can see how, like most of these, at least 1/3 of users are discontinuing within that 12-month period. And sometimes this can be due to like them wanting to get off, to get pregnant or something like that. But most of the time it's due to various symptoms that they're getting. So you can take a look at this list and compare the different methods. If you want to give this video a quick pause. Here we have some more different efficacies and then discontinuation rates. And then you can compare these values to the symptothermal method that you've been learning with the typical use from 88 to 98% and perfect use up to 99.6%. So it's pretty on par with a lot of these hormonal methods, but you don't have to subject yourself to those various hormones and different things if you don't want to. It's just really great that learning this method gives you another option in your toolkit if you choose to use it. So if you remember from the intro video, hormonal contraceptive is basically preventing pregnancy in three main ways. It's preventing ovulation, it thickens cervical mucus, and it suppresses the endometrial lining growth. So basically, it is disrupting the normal processes in your body that help with ovulation, implantation, and sperm movement. Different forms of contraceptive use different hormones. A lot of them use a combination between estrogen and progesterone. Some of them just use progesterone, and then we do have those hormone-free like copper IUD as well. And basically, the synthetic estrogen and progesterone are suppressing ovulation by inhibiting the secretion of gonadotropin releasing hormone from your brain. So this ends up suppressing FSH and LH from your brain as well. And you now know that without those, we cannot grow a follicle and we can't ovulate. So if you were to look at your ovaries while on most hormonal birth controls, you would see that they look more similar to ovaries of a woman in menopause. So if you are using a method that only has progestin in it, so that would be things like the IUD, the mini pill, or the implant, then you may still be ovulating, but it will be more sporadically. So you likely won't be ovulating every single time. So this is nice because your body can still make some estrogen and some progesterone, although it won't be at the amounts that you would if you were naturally cycling. So you might be questioning, if it's not preventing ovulation, how am I not getting pregnant then? And that is because it helps to thin the uterine lining to make implantation more difficult. And then it also creates that thick cervical mucus so sperm can't get through. Along with that, if you're using the IUD, then it can create more inflammation in that cervical area. So this can help prevent that as well. A uterine lining thickness of approximately 10 millimeters is optimal for implantation, where on the pill it's approximately 2 to 5 millimeters, and implantation is unlikely to occur at 6 to 7 millimeters, so the possibility is pretty low. So these are some different risks that come with hormonal contraceptive. You can read through these, there's a lot of them, and although like the increased blood clot risk and the increased risk of like heart attack, stroke, and different increased risk in certain cancers, although these risks are higher, they are still relatively very low. So it is very unlikely that you will actually have an issue like this, although it is real, so we do need to talk about it. But most of the time, the symptoms that you might see, they're not really life-threatening, but they are still hugely important in your daily life, and we need to take them seriously. So when we're talking about thrombosis or blood clot risk, contraceptives increase your risk about 4 to 7 times the normal risk. And basically what this is a formation of a blood clot inside a blood vessel, which obstructs the flow of blood through the circulatory system and can cause major issues. And usually this is more of a risk with certain types of birth controls, like those with higher estrogen. So you could also see elevated blood pressure, you could get irregular bleeding or cervical erosion, which could happen from that unstable uterine lining. You can get bleeding just from like the end of your pill pack, which is a withdrawal bleed and not a true period. Decreased bone mineral density, and this is because your estrogen and progesterone play a huge role in your bone mass development. So if you're suppressing these hormones, it can have an effect on your bone mass, and oftentimes this happens with a Depo-Provera shot. That one specifically because it shuts down your hormones so much. And that's why there's like that 2-year maximum recommendation to be on that type of birth control. And then if you do come off birth control and you have an irregular period, like hypothalamic amenorrhea, where you don't see a period for a really long time, that can also affect your bone mineral density. So it is really important that we figure out why this is occurring and how to get you to ovulate regularly. You could see an increase in blood sugar issues. This is why if you have PCOS, they tend to prescribe you like the pill or some form of birth control. And this can help your symptoms like a band-aid approach, but everything is still happening beneath the surface, and it can worsen PCOS and issues in the long term, like heart disease or diabetes. You could see recurrent yeast infections or bacterial vaginosis just because the differences in hormone fluctuations. This can make your vagina more alkaline, and it can also modify your gut bacteria and your vaginal bacteria as well. You could see mood changes like depression, anxiety, or panic attacks. You could see some weight gain. I know a lot of practitioners say this isn't true, but indirectly it could cause an increase in weight gain just due to its effects on your blood sugar regulation, your bacteria, and your thyroid. So you could see fatigue, again, those thyroid issues. You could get migraines or headaches. If you are experiencing any migraines or headaches while on the birth control pill, especially if you're on one with estrogen, that is something to definitely bring up to your doctor. You could see a loss of sex drive or low libido, and that can be due to the lower testosterone. So when you're on hormonal contraceptives, this significantly reduces your free testosterone levels by an average of about 61%. And that's because hormonal contraceptives increase a protein called sex hormone binding globulin by about 200 to 400% because of the effects of estrogen on the liver. With this low testosterone, you might find that you have a lower libido and you just have no interest in sex or reduced interest. You might see hair loss, thinning, or shedding, and this is often linked to more of those progestin type of birth control, so like the IUD, because the certain progestin that they are using is quite similar to an androgen like testosterone, and you could see skin changes, rashes, or increase in acne as well. So if we touch on cancer risk for a sec, the International Agency for Research on Cancer has classified the combined oral contraceptive as a group 1 carcinogen due to a clear link between hormonal contraceptive use and cancers of the cervix, breast, and liver. Hormonal contraceptives are associated with a reduced risk of endometrial, ovarian, and colorectal cancers, causing researchers to conclude that the overall net effect is positive. So although we have an increased risk in certain cancers, because we have a reduced risk in others, it's not really mentioned that much, and it's kind of net neutral basically. So just be aware of that. The hormonal contraceptive can put you more at risk for depressive mood, and this could pop up immediately or just escalate over the years. So if you are struggling with mood challenges, this is something to consider. Many women do find they have mood changes or panic attacks when they are on these types of hormonal birth controls, and some notice that anecdotally after they get off, they experience a more stable mood. So we'll just go through a few stats on depression risk. Women taking the combined pills were 23% more likely to be prescribed antidepressants. Women taking the progestin-only pill were 34% more likely to be prescribed antidepressant. Women using progestin-only methods like the mini pill or IUDs are significantly more likely to be diagnosed with depression. Teens were 80% more likely to develop depression when taking combined pill. Young women who use hormonal contraceptives have 3 times the risk of suicide. Teens have double the risk of suicide after 1 year on the pill and are at 30% higher risk after 7 years on hormonal birth control. And suicide risk peaks around 2 months after beginning hormonal birth control. So these are just some things to keep in mind. Please talk to your doctor if you have concerns or mood shifts. And if you have any friends that are going on the hormonal contraceptive, just keep an eye on them as well and look for any changes. Another risk that is not talked about nearly as much as it should is the nutrient deficiencies that could happen due to particularly the pill. Over time, these hormonal contraceptives can affect the delicate balance of vitamins and minerals in the body. So the vitamins that are most affected are folate, B2, B6, B12, zinc, selenium, phosphorus, magnesium, CoQ10, and then vitamins A, C, and E. And then we also seem to have an increased level of iron, copper, calcium, and cadmium found in the body. So there's a lot of different symptoms that you could have on the birth control pill. A lot of the time we can see that weight gain, we have mood disorders, you just don't feel yourself, you have sleep issues. This could potentially be due to the subclinical vitamin and mineral deficiencies. So if you're on the hormonal birth control pill or you want to come off soon, I would definitely consider supplementing these specific vitamins and in the amounts that you need. So talk to your doctor if that would be right for you. And this can help to replenish nutrient stores and perhaps lift any symptoms that you might be feeling and make the shift from coming off birth control a lot easier. So when you want to come off hormonal birth control to get pregnant, this is often associated with a temporary delay in the return to normal fertility and therefore the time that you can achieve pregnancy. Now, some people do get pregnant right away. That is definitely possible, but for others, it can take quite a while. So the normal return is about 6 months to 2 years, and this is for your cycle to normalize. So the average delay is related to both the type of hormonal contraceptive used and the duration of use. So long-term use is 2 years or more. So the average time until pregnancy occurred was 4 months for condoms, and this falls in line with our 25% chance to get pregnant. 6 months for progestin-only pills, 8 months for the combined pill users, 8 months for if you were using an IUD, 10 months for the implant, and 15 months for the injectable, which is like Depo-Provera. So this can lead some women thinking that there's something wrong with them, which leads them to head to a fertility clinic. And the fertility clinic, of course, mainly just suggests different procedures that they can do. And sometimes this can definitely be necessary. And it's truly amazing that we have this kind of technology. But sometimes all we need is just a bit more time off these birth controls for our cycle to regulate, and then proper diet and lifestyle to help support this. So like I mentioned earlier, your ovaries go into more of a menopause state when you are on certain birth controls, and hormonal contraceptives can temporarily lower these ovarian reserve parameters, so your AMH levels, your antral follicle count, your ovarian volume, and many women are testing right away off birth control, and this can cause a lower value than they're expecting, but these values can rise after months off the hormonal contraceptive, approximately 6 to 7 months. The combined hormonal contraceptives temporarily shrink ovaries up to 50% until you're off of them, and it takes about a minimum period of 6 to 7 months off hormonal contraceptives for ovarian reserve parameters to normalize. This can also limit cervical mucus seen off birth control and can cause erratic basal body temperatures. So when you come off of birth control, however your period was like before you got on the birth control is likely how it will return. This also depends on different lifestyle factors, medical conditions, and the type of birth control you were using. If you had acne before you went on the pill, maybe that's why you went on. A lot of times this does tend to come back around that 3-month mark. And you can also see an increase in acne due to the testosterone surge, which can happen once you come off the pill. Remember how we talked about that sex hormone binding globulin, how it was grabbing onto all the testosterone, which was therefore lowering that testosterone. So what happens when you're on the birth control is that your body upregulates testosterone to make like a minimum amount so it can like do its processes. So when you come off of the birth control pill, your body is still making testosterone at that level, but the SHBG comes down a bit. So then you have this surge of testosterone, which can increase acne. This tends to level out by about the 1-year mark, and you can do a lot of different lifestyle, diet, and supplement things to help support your body through that. You might see the return of cramps or your PMS, like mood shifts, bloating, or breast pain. You could have different bleeding patterns. You might see some spotting as your cycles regulate. And if you have PCOS or endometriosis, you can get the return of those symptoms as well. But again, luckily, diet, lifestyle, and supplements can help level this out, helping you love your natural cycle. The positives of coming off of birth control: you may have improved moods, you might feel more like yourself, like a fog has lifted, and you can rip off that birth control band-aid, which is just suppressing your symptoms and covering them up, and you can actually solve the root causes. And of course, you'll regain your natural cycle and hormone rhythms. Let's talk about using the fertility awareness method as birth control when you come off of your form of contraceptive. So cycles may return right away, most returning by that 3-month mark. But again, like we mentioned, it can take longer depending on which form of birth control you're on, the duration, plus your cycle history. And your cervical mucus observations may be scant or harder to determine, and your basal body temperatures may be more erratic, but these generally level out over time. So we do suggest waiting until you feel confident in determining your biomarkers and at least 3 months before relying on FAM as your primary birth control method. But it's really important to keep charting and to build that confidence, which is very helpful in determining your return of fertility, because basal body temperature can help you confirm if ovulation is occurring or if you're getting those anovulatory bleeds, which are those bleeding patterns without ovulation. And that can happen especially with longer cycles or PCOS. It's also quite common to see shorter cycles or a short luteal phase in that time. If you've yet to come off of birth control, proper support before you come off can be essential to making this a more easy shift and regulating your cycles faster. So if you look at the charts below, you could have a shorter cycle like the first one there. The one in the middle just shows very low hormone activity. You have a couple EL days. That's something that you could see. Or you could have the bottom one there where you have really long cycles with different mucus patches. So it really differs in what you will personally see. But anyway, you can support your body during this time with diet, lifestyle, testosterone supplements can help that return of fertility in those regular cycles. So these are some things that you need to focus on before coming off, or if you've already come off. Remember that hormonal contraceptives deplete these nutrients, so we can incorporate nutrient-dense foods to help replenish this and determine if supplementation for a period of time is appropriate for you. Your steroid hormones like progesterone, estrogen, testosterone, and cortisol are synthesized from cholesterol found in animal fats, so that's very important to include as well. You'll want to optimize your sleep and reduce xenoestrogen exposure to further balance reproductive hormones, and we'll go into this further in the next lesson. We also want to restore gut bacteria because these hormonal contraceptives can disrupt the delicate balance of friendly bacteria in your digestive tract. So consider incorporating foods that help support gut health like fermented foods, and then avoid anything you're allergic to or sensitive to. And then with the added synthetic hormones from these birth controls, it puts a lot of stress on your liver. So supporting your liver is important too. And that was it for this lesson, all about birth control. In the next lesson, we're going to be covering lifestyle for healthy cycles.